Good morning. Welcome to the National Center for Medical Education, Development and Research, Communities of Practice webinar, a virtual roundtable discussion, how motivational interviewing can help healthcare providers meet vulnerable populations where they are. Today is October 15th, 2018, and our webinar will run from 11 a.m. to 12 p.m. Central Standard Time. Our partners on today's webinar are the Downtown Women's Center, T3, Think, Teach, Transform, and Meharry Medical College. This project is supported by the Health Resources and Services Administration, HRSA. A few reminders: please mute your microphone. The webinar is being recorded. We will address questions during the Q&A section. Thank you again for joining today's webinar. We wanted to begin with an overview of the agenda. I will give a brief overview of the National Center for Medical Education, Development and Research. We will have a personal story by Denise Smith, review community engagement with Amy Turk, and have a discussion of motivational interviewing with Ken Kraybill. And then we will have our virtual roundtable discussion that will be facilitated by Dr. Patricia Matthews-Juarez. The National Center for Medical Education, Development and Research is housed in the Department of Family and Community Medicine at Meharry Medical College. The aim of the center is to address the needs of persons experiencing homelessness, those who are LGBTQ, and also migrant farm workers. We identify these three groups as vulnerable populations. Our focus is to translate research findings into medical education curriculum and clinical practice into primary care training and practice guidelines. We operate under the leadership of Dr. Patricia Matthews-Juarez, the project director, Dr. Paul Juarez, the center director, and I am Katherine Brown, the director of the Communities of Practice. Our learning objectives for today are to identify the 4 elements of the mindset and heart set of motivational interviewing, explain the 4 processes that guide motivational conversations, name the 4 core interviewing skills used in motivational interviewing, explain the benefits of utilizing motivational interviewing for vulnerable populations, LGBTQ, persons experiencing homelessness, and migrant farm workers, explain how motivational interviewing assists with medication-assisted treatment, and to discuss strategies for incorporating motivational interviewing into medical education. Today's speakers are Denise Smith. She is a community advocate with the Downtown Women's Center. Amy Turk is a licensed clinical social worker, the Chief Innovation Officer with the Downtown Women's Center. Ken Kraybill, MSW, is the Director of Training for T3, Think, Teach, Transform. And Dr. Patricia Matthews-Juarez, who is the Project Director, also Vice President for the Office of Faculty Affairs and Development, Professor, Department of Family and Community Medicine, Director, Research Training Corps, Health Disparities Research Center of Excellence at Meharry Medical College. For more information following today's webinar, I've listed my contact information, which includes telephone, email, and also social media handles. And for more information about the center, please visit our website, www.ncmedr.org, and all of our social media handles are listed, and this webinar will be featured on our CoP TV as well as our website. We wanted to begin today's webinar with a video that was done by the Cleveland Clinic. We think that it is a powerful video that may portray situations that some of us are experiencing or have experienced. I am going to welcome our first speaker, Denise Smith, who is with the Downtown Women's Center. If you can give me 1 second. Can you all see my screen again?
Yes.
Yes.
Okay, so I'm going to welcome Denise Smith, who is a DWC advocate with the Downtown Women's Center. And one of the DWC's most effective approaches is to elevate the voice of those most impacted by inequity. And part of their strategy is the utilization of peer leaders and advocates. And so we are so excited, Denise Smith, to have you share your insights as a peer leader and advocate who elevates the voice of inequity.
Hi, good morning. My name is Denise Smith. I came to the Women's Center in 2014. They helped me on my journey to get clean on crack for 16 years. After I went to a outpatient program, I needed to go to somewhere where it was positive. And by coming here and going to the health and wellness workshops, I got to learn how. I learned about me. I started communicating. I started sharing. So it helped a lot with my journey because I found out who I was. I didn't have to hide what trauma and disappointments I went through no more. I wasn't embarrassed about it anymore. So it helped me to heal. The lying and the deceit kept me using crack a lot of years because that was my way of escaping. By going to the program, God led me there, and the program led me here. It was a journey. So now I decided that because of my drug addiction, I developed a lot of chronic diseases. That's my consequences. And I had to accept that. It was hard, but coming to the Women's Center, they helped me to accept it, but deal with it so I can manage my diseases. So I decided I was going to share with other women what I went through to help them, because it's no joke. Learning how to manage chronic diseases that could have been avoided. I finally started going to a doctor. I didn't before when I was using, but I had to start going to my doctor, and I started developing a relationship with my doctor instead of going in there with an attitude like, you help me, do it now. It wasn't like that. Going to the Women's Center, once again, the workshops help you to learn how to talk to people so you can get what you want. You understand? We big glad to have a partnership. I explained to her my anxiety, what I went through. So it wasn't all about the chronic diseases. It was more of my mental state. You know, my mental state kept me sick because I was guilty, the guilt from causing the diseases, and I couldn't let it go. So once we talked, she found out that I needed therapy to get over the guilt and to get reinsurance to like myself, to accept the consequences, and that's what you did. Now let's move on. So once I got through the therapy, me and my doctor had a better relationship because I explained to her what I was going through. So then we broke it down where she could help me. She taught me how to help myself so I can receive her help. Mm-hmm. You know? It wasn't all about give me a pill and go home. It was about, okay, what's going on with you? You need to change your diet. You need to, evaluate you more, see where you are each day, and I started doing that. I started, because I gained weight since I stopped using drugs, so I changed my diet. I started eating more vegetables. She said, she learned me how to do more research take care of me. Because once I left out of that doctor's office, it was about me. I couldn't take her with me everywhere I went. So just last week, I went to see my doctor. She did, and I was so uptight. I wanted everything right away because I wasn't feeling well. And she didn't tell me what I wanted. So what I did, I went a little step further. I said, okay, since you can't tell me what I want, you can help me. Refer me to somebody else. And once she referred me to someone else, here come the treatment. Here come answers that I needed. So now I'm on my recovery from the earaches and the nose sinus and stuff because I went a little step further, But I didn't get angry with her. I just said, well, I think we need to go a little further. Since you can't help me, lead me to someone else. So I learned how to be patient, take a deep breath, and just ask for help. And she didn't get angry with me. She just said, I can't help you. So let's look a little further. So learning how to be polite with somebody and letting them know I need help. So, and I want it now, and so could you help me to get it? That doesn't mean that you're angry with your doctor. It doesn't mean that I need help. So I was advocating for myself. I want to know what's going on with me so I can have a peace of mind because I had anxiety. Nobody was telling me nothing, my doctor. So by me advocating for myself, researching, talking, being polite, I got my answers. Now I'm taking tests, and I know, I'm healing. Really, and I wouldn't known this if I wouldn't have stopped using crack, so I could sweep up my anxieties, my fears, my trauma, going to the outpatient, learning how to communicate, talk, coming here, going to the workshop. I wouldn't have been here today. So I went through steps. I accept that it was time for me to take care of myself, put that pipe down, put the crack down, and get myself together so I can live. I wanted to live. I don't want to run away from me no more. I don't run away. My disease was running away from life, not accepting life on its own terms. It scared me. It's scared. I still go through storms. I'm going through a storm now, but I'm being taught how to ask for help, communicate, let somebody know I'm going through this. Can you help me? And then I get okay. And I cry, but crying is okay. It's not using a pipe today. It's crying, letting me know that I'm going through something. And the storm, it'll pass. But using that crack is not going to help it. Today, I know how to communicate. So I tell the women here, communicate, open your mouth. Communicate is healing. Ask somebody, talk, so you can heal. So that's what I do. That's why I became a health team field leader, so I can help anybody with my story. I don't lie today what I've been through.
Thank you so much.
Mm-hmm.
As you can tell, Denise is so inspiring, and when we listen to each other, we build and practice better services and better care for the people that come to our community-based center in Los Angeles called Downtown Women's Center. Just a quick overview, we provide free meals and a place for showers and basic needs for women that are experiencing homelessness or living at very low income. And that leads to having staff help them find permanent housing, connect to health care, and we do that in combination together. So with people who are currently experiencing hardships, they are also supporting women, as Denise does, to help them take next steps forward. We also help people find jobs currently with us in our stores called Made by Downtown Women's Center, or in the community doing jobs of their career choice. And we support evidence-based practices at Downtown Women's Center. First and foremost, on the next slide, Katherine, we practice trauma-informed care. And as you can hear from Denise's story, the importance of understanding where someone comes from, or as the video showed, the shoes that they are walking in, is primary in this work that we do. So trauma-informed care recognizes the widespread of trauma, responds in a way that fully integrates understanding of trauma and seeks to not re-traumatize people, which we know in our healthcare field is very easy to re-traumatize people. And so in our practice, we do everything possible to not. And we use evidence-based practices to help shield us from re-traumatizing people, such as critical time intervention, a 9-month case management model that proactively helps people reintegrate into community, especially after experiencing homelessness and moving into permanent housing. We find it's a very effective model to help people proactively use healthcare services. And you know, as was reflected in Denise's story, harm reduction is really important. It's not that there's no storm, as you said, or that every day is peachy, but she's doing everything possible to reduce the harm to her life and to move forward and to address her health concerns. And certainly in our field, finding people housing as fast as possible is called housing first, not waiting for folks to prove their right to housing through sobriety programs or whatnot. So housing folks first, and while we are providing services and continuing to provide services to help folks address concerns. But foremost to today's conversation is the evidence-based practice of motivational interviewing. I've had the privilege of hearing Ken's presentation throughout the years at various conferences, and I'd like to hand it over to the expert in motivational interviewing now.
Well, first of all, thank you so much, Amy and Denise, for being part of our community.
Thank you so much.
Yes, and we appreciate you. And I want to just say that as part of our community of practice, you are the expert. Everyone at the table is the expert because we all bring a lived experience. No one experience is better than the other. So Denise, you are expert, and Amy, you are expert. So thank you all for being part of our community of practice. Our next speaker will be Ken Kraybill of T3, Think, Teach, Transform, who will be speaking on motivational interviewing, building skills for whole person care, followed by our virtual conversation facilitated by Dr. Patricia Matthews-Juarez. On your screen in the chat box, if you have questions, please feel free to post them. And also you will see the link to our post survey, and we do ask that everyone please complete the survey to give us feedback. Thank you so much, Ken.
Welcome, and thank you, Katherine. Thank you, Denise, so much for your telling of all the really essential ingredients of what it takes to create conditions under which people are more likely to change. And you talked about a positive environment, you talked about the importance of relationship, you mentioned gave you an opportunity to kind of examine who you are, where you were, and who you want to be, that kind of self-introspective thing. You also mentioned how it helped you move from being reactive, wanting things right now, to being able to be more responsive and think things through a bit. And you found your own voice in all that. And you wanted to, I love the way you put it, you were running away from life, but you wanted to, you didn't say this, but you wanted to run towards life or wanted to live. And so all of that is exactly, I think, what motivational interviewing is really trying to do, is create the conditions under which people, Denise and others can, all of us for that matter, can really take a look in the mirror of our lives and kind of decide, you know, what, if any, changes we want to make. And the beauty of this is that everyone has within them already existing motivation to want to live a life of wholeness, of integrity, of connection, whatever words we want to use. But that does get covered up sometimes by the trauma, by addiction, by mental health issues, by racism, by sexism, by homophobia, by all these things. And so tapping into the best of what people have inside is really what I'm about. So I have a lot of material here, and I usually do 2-day trainings in this, so I'm not going to talk super fast so I can cover it all, but we'll see how far we get. But one of the things I like to do is just start with asking what is MI? And I realize in this current environment or this technology right now, I can't see your responses, so I guess I'll answer my own questions. But for those of you in medicine, please acknowledge that MI, yes, it is a myocardial infarction in some cases, but not today. So MI is a practice that I think it grew up out of the substance misuse treatment field, but it's really begun to permeate all of health and human services, and I think for good reason. One of the things that I think is important to distinguish between is this idea of what are your hopes and what are your goals? And I think all of us would probably say something along the lines that our hopes, particularly in providing healthcare, is that people will choose healthier behavior. You know, their self-determination will cause them to go to the doctor, but also to have the ability to self-manage their lives, especially when they live with chronic conditions, and that they're able to just become happier, healthier people. And those are all the hopes that we all bring to this work, and a whole lot more. However, when we examine what are our goals, I hope you might notice that that's really a very different kind of direction. Maybe not a direction, but an approach. And I would suggest to you that our goals as practitioners is that we really want to be able to facilitate conversations with people in which they are able to actually do what we just talked about, to allow people to really take a good look at their lives, and then to help them feel inspired and to strengthen their motivation to change in a positive direction. And I think MI provides both the kind of the mindset and heart set, we call it, as well as the skill set to do that. So we're gonna just examine this a bit. What I'd like to do, and obviously it's up to you what you do, but I'd love if you could participate in this just in your own space where you are. And what I'd like to do is provide a personal taste of MI for you, in which I'm going to ask a few questions that will allow you to consider something in your own life that might be a dilemma right now. It might be something you're wrestling with, something that you've been thinking about changing but haven't changed yet. This can be an attitude, it can be a behavior, it can be around everything from procrastination to judgmental to the list goes on and on and on. But if you would, just for the sake of this exercise, think of something in your own life that you have been thinking about changing, but haven't changed yet, and maybe not some deep, dark secret you've never shared with anyone, but also not something so kind of superficial as, you know, what color shoes shall I wear? Not that that doesn't matter, but something a little more substantive. So it's up to you if you choose to do this, but I'm gonna pose a few questions, and these questions are framed around the idea of exploring ambivalence, exploring the fact that you might feel two ways about this situation, and also then begin to explore some of the things and the reasons and how and why you might do that. So the very first question, and I'm going to move quite quickly just because of the nature of this webcast, but in real life we would take our time, but these are key questions you might ask yourself. What is the dilemma? And in thinking about that, what's okay in your life about how things are right now? You're still living your life, things are happening, so what's okay about that? And of course, on the other side of that is what's not so okay. What concerns you, what bugs you a bit, what's a little itchy about how things are. And then another way to get at that kind of exploration of ambivalence is to ask, so if you choose not to change in this particular area, not to make any take any actions towards a positive change, what if anything would be at stake? Would be some consequences to yourself, to others? How would it affect your relationships? How would it affect your health? So again, all of these three questions are really at the service of sort of looking at both sides of that ambivalence. Now, in motivational interviewing, we do explore what's happening now and tie it to the past, but we also want to help people consider, to envision, imagine a future. And so here are a few questions that we might ask around that. One of those might be, if you were to change in a positive direction, whatever that might be, why might you do that? What might be some reasons for you to do that? Your personal reasons. And of course, most of us, when we consider things that we've been thinking about changing, we can come up with reasons for that, usually multiple ones. And so in so doing, you might also then wonder, well, what would be your best reason for doing that? What would be the most compelling one? So another, and what you'll notice here is the questions that are going to unfold here are really the questions that get at different aspects of this thing we call motivation. And so in addition to reasons, I might ask, if you were to change, how would you go about it in order to be successful? In other words, what would be a pathway that you think would be most likely to work for you? And I think it's important to remember there are many, many pathways that people pursue in order to be successful in making change around all kinds of behaviors. It's got to be what works for you. So we have reasons, we have how you might do it. Another question I might ask is, how important is this to you in the here and now? And often we ask this in a scaling question. You don't have to, but it might be, on a scale of 0 to 10, if 0 is not at all important and 10 is like super urgent, where do you find yourself on that scale? And then somebody might say, well, I'm at a 4. And you might say, how did you manage to get to a 4 and not a 1 or a 2? So the idea there is helping people see how they have progressed to at least that point. And then another question around that might be, and what might have to happen, or what connections do you have that would create that number to go one number higher? Another question we might ask is, how confident are you that you could change? And my guess is, certainly in my experience in working in homelessness over the years, is this is the one that really is the catcher for people. Most people want to change, have reasons to change, how they might do at times, although not always, but how confident inside, outside, with outside resources, inside resources are you? And so again, you could use a scaling question or not. And then a few other questions, and I should acknowledge that this might start feeling like it's an interrogation. That's not MI, and this is not how MI works. I'm just sort of tossing out the really key questions that at some point we might want to ask some of them. But another question might be, who might be helpful to you? Because change is almost always easier to do with somebody else in relationship. And then a very last question we often will ask is just to invite people to consider what they might do as a next step, if any, towards that change. And here you see that the idea is to have a person think about what might you be able to do as just a small incremental next step that is doable, manageable, achievable, that would allow you to make progress towards change. Because I think it's important for us to recognize that change is a series of steps. It's rarely one big leap. So I'm going to pause there and just invite you to consider in your own practice, in your own interactions, even outside of your professional practice, that you might at times find it useful to ask maybe just one of these questions or two of these questions. I will say that the ones that seem to be most pertinent for most people are importance and confidence, and also reasons can be very much helpful to help people strengthen motivation. All right, so MI, what is it? Well, it's a way of facing forward with people. We come alongside them in solidarity, in empathy, in compassion, much like that video showed. We really want to acknowledge where people are, hear what they hear, see what they see, this kind of thing. But we also want to create an ability to help people begin to look forward in their lives, to move towards life. And so when we practice this approach, there's no need to be clever, complex, even highly educated. Really just being a compassionate human being who has a healthy curiosity about you, about what's going on with the other person, can be sufficient. And the uncluttered part is really the part that gets in our way as helpers. And I think we all possess this, and it's probably something that's comes with our genetics. But this idea that we can fix people, that we can change people. And then we have these ideas of what people ought to do, and then we offer them. And I'm calling that clutter. I'm also calling that that impulse. It's a healthy desire, a healthy impulse to see people change, but it's also, interestingly, the exact opposite of what's helpful. And so there's this great quote that people who want to help in the most people who want to help. Now I'm totally forgetting the quote. I'm sorry. I'll come back to it. But anyway, the idea here is that when we hear people's problems, we as human beings naturally begin to formulate ideas of what might be going on with them. And then, of course, we often offer that helpfully, but it turns out not so helpfully, because it actually becomes a form of coercion in some ways, subtle coercion, helpful coercion, quote unquote, but it's something that actually pushes people away because it pushes against their self-determination. And the quote I was thinking of is that people who want to help in the worst possible way often do. So I want to just suggest to you some ideas of what an MI conversation looks like. And rather than describe it to you, let's just play around with something for a moment. Let's just say you've explained to a 50-year-old patient why it's recommended to be screened for colon cancer. And the man replies, well, I take good care of my health and I don't have a family history, so I don't see why I need to be screened. And it's for you now to respond, right? And so there are a number of ways you could respond. And again, in the absence of a chat box and a back and forth, a statement you might make to show empathy and understanding might be something like, it doesn't seem necessary to you. Or maybe something like, you're not sure why it's all that important, or you can't imagine why you would be at risk given how well you take care of yourself. These are statements that are really intended to just say, I'm hearing what you're saying, and and it's also inviting the person to explain a little bit more about what they need. And then we might ask something like, well, tell me all the things you do to be healthy, because that would be an interesting conversation in and of itself. And also tell me, what you already know about risk factors for colon cancer, and what concerns do you have about being screened, perhaps. What we're doing here is we're kind of nudging the conversation along through statements and questions. And another response we might get is, I have way too many issues in my life right now, right, to worry about one more thing. You got a lot on your plate. There's a lot going on in your life. And then we might also suggest that, you're concerned about what if you got bad news, because there's sort of that feeling, that sense that embedded in that statement, there might be some concern. Or we might ask, what are your concerns? Or how, in what ways, what worries you most about getting screened, and this kind of thing. So we're really trying to get at the gist of it. What if it came back positive? I don't think I could think of that. Yeah, that's a really scary thing to think about. It feels like it might tip you over the edge, or the possibility of having colon cancer worries you a lot. You might ask, how have you handled news like this in the past, or who could be helpful to you? Again, there's no one set response as a reflection or a question. It's really just being able to hear not only the words, but hear what's surrounding the words. You're wondering, you're concerned about, you're thinking, you're feeling. And this is the art and skill of providing empathy. You don't walk up to people and say, hi, I'm feeling really empathic towards you. You want to respond back to them what you is an educated guess, basically, about what they're thinking and feeling. So we respond in that way. Or somebody says, I probably should, but I really don't want to. And you might say, well, yeah, it sounds like part of you is sort of that you really would rather not. know and what's going on. And then there's a part of you that sounds like it would be important to know. And so again, the ambivalence you hear here, and we respond to that. It would be so easy to just jump in with automatic education. But if we don't sort of find that way of creating that relational context that Denise talked about and really hearing where a person's coming from, we can't assume that people know we care. We can't assume people know we're being empathic. We have to say it, I think. And then it creates the opportunity for us to have a deeper conversation. What difference does it make? We all have to die of something. You know, I'm gonna move on here, but we get all kinds of responses, don't we? And so we have to know how to respond in the moment. What would you do if you were in my shoes? Well, you might want to actually share from a personal and professional experience what that is, but you might also reflect initially that, you know, yeah, you're trying to make the best decision possible and you want to gather information or whatever. So anyway, I'll stop there. But one of the things that occurs to me is that when we have motivational conversations with people, we're always faced with, what am I going to say next? And what we say next matters. What we say next makes a huge difference in whether or not it might enhance a person's motivation to change, or it might decrease their motivation to change as well. We have the ability to make a difference in that way. All right, so what are we talking about here? Well, it's a collaborative conversation style. And I want to focus on style because it's not a script, it's not set questions, it's not, you know, a 3-point ask this, that, and it's really a style, but it has a framework around it that is the MI framework. But the whole idea, the goal here is not to get somebody to change, but to help them strengthen their own motivation and commitment to change. And that's a pretty big difference there, because again, anytime we're trying to get somebody to do something, I'm going to suggest we're committing an act of violence. And that's a strong word, I know, but it's a violation of who we want to be with people. And anything we do to try to get or coerce or, you know, sort of make people do things, we are now committing acts of violence. And that's the exact opposite of what's helpful in the law. Another way to think about this is it's a person-centered counseling style for addressing the common problem of ambivalence about change. And so one of the things we know is that ambivalence is the driver here. It's not denial. It's not that people don't want to change. It's part of them. They do want to change and they don't want to change. And so some of you have seen probably this symbol. It's kind of, it is the Nike symbol, but it's a little kind of twisted, right? Here's what it stands for. And really this is the human condition around change. It's scary, it's frightening, and we don't want to do it, and yet we do. We think it would be worth doing. And it's this condition that we're really addressing when it comes to all kinds of behavior change. Here's another longer definition. And at the very bottom, it says, we do this, we explore a person's own reasons for change within an atmosphere of acceptance and compassion. This is a simple definition, probably the most memorable one. We're really helping people talk themselves into changing. They can get themselves to change, but we can't get them to change. So, all right, how does this work? Well, this is a very oversimplified diagram, but we all are talking to ourselves all the time, and we're exploring within that what's concerning us, what our hopes are, what our values are, what goals we have, what's getting in the way, what strengths do we bring, and in this whole mishmash, what will emerge is statements that sound something like, well, I have a desire to have my life be different. I want things different. I know ways that I could possibly move in that direction. I have reasons for that, and it's pretty important to me. All of that talk is really important talk, but it's preparatory. It's not yet ready for action, but it's hugely important. It's the part that really builds and strengthens our motivation. And then, of course, we would hope that people would get to the place of saying, I'm going to, I'll make that phone call, I'll make that appointment, I will take these medicines, I will exercise more, I'll start eating more healthfully, et cetera, et cetera. And then, of course, we anticipate people will take steps. All All right. Well, have you ever met this girl? Chances are you've been this girl, even if you're a guy. We've all met her, right? And I think a lot of people at first impulse would probably just say, well, she's stubborn, she's dug in, she ain't gonna do it. She might even be a brat. She's somebody who she's a case to be reckoned with, right? And that's often the very first kind of take that we will have with somebody who appears somehow to not being cooperative or adherent or collaborative. And so, yes, she is those things. But let me now show you a picture of a different girl. And there she is. What would you call her? What would you say her strengths are? And I'm hoping that most of you would immediately think, wow, that's a pretty cool person who has strong ideas. She's thought it through. She knows her mind. She's determined. She stands up for herself. She's an advocate. She is willing to speak truth to power. All of those things, right? And of course, it begs the question then of who is she? Well, it really depends based on how we see her. And the reason this is important for MI is because how we see people, and do we see them primarily as being people with abilities, strengths, and already existing motivation, or do we see them more perhaps like an empty glass on the right here? If we see them as an empty glass, then it becomes our task to fill them with motivation, with knowledge and information, which obviously is important at times. But it also suggests to the person that they're an empty vessel, and the messaging is very disempowering because it's like, you got nothing, and I'm the expert here, and I got a lot, and lucky for you, I'm in your life, kind of thing. Really what we're looking at here is people already being filled with hurts and nightmares, addictions, delusions, impairments, all of those things. And you and I are all filled with those things. But we also have healthy hopes, dreams, desires, wisdom, strengths, resources. And how we choose to see that person or what we choose to look at in that glass will make a huge difference. And I'm not suggesting it's either or, it's really a both and situation. But if we don't look at the strengths, at the desires, at the hopes, and we just look at deficit behavior, we lose so many opportunities. So in MI, it's not about giving people a drip line of what they lack. It's really more about evoking from people what they already have. And that's a big difference in how we see people. The idea being that if we see people as already being expert, wise in their own lives, and we provide the proper conditions and support, they're likely to thrive. And I often think about this in terms of if I were to give each of you a seed right now and say, here, make it grow, you'd have a hard time doing that, perhaps sitting in your office. But if I said, please go out and create the proper conditions and support and circumstances for that seed to grow, we would all know what to do. We would go out and put it in proper soil and sunlight and water and all those things. And that's really the MI approach. A bumper sticker we might put out there would be, you already have what you need, and together we will find it. So Katherine, I'm looking at you here and I'm realizing that, yeah, I don't have a lot of time.
Yeah, because we have about 13 minutes. So I know the chat box looks like it's getting full, and I know people have questions. So it would be a good time if we want to open up the floor so that the participants can engage in the discussion. If that's okay? That's
fine. And I'll just say this much. What I'm introducing here is kind of the mindset, the heart set of, and we often talk about that in terms of partnership with people, in terms of acceptance, seeing them for their strengths, seeing them for their intrinsic value, their intrinsic potential. We see them for kind of through empathic eyes and those kinds of things. And we often, another part of that is being compassionate and then evocative, calling forth from people what they already have. And that is really the MI approach. And of course, there's a whole lot more to it, but I will stop there, and I'm happy to take questions, comments, thoughts.